Thank you, Mr. Chairman. Thank you, Mr. Secretary. Coronavirus, COVID-19, is a respiratory disease, is it not?
That's correct, sir.
And at the Center for Disease Control, you have an expert who directs your respiratory disease section, don't you?
Yes.
And what is her name?
Dr. Nancy Messonnier runs the respiratory and influenza branch, yes.
And was it your decision yesterday to exclude her from the press conference on this issue?
No, we actually had her boss, the senior career official, Dr. Ann Schuckett, was at the press conference.
Yes,
she was
you
up
did,
here.
but not the respiratory disease expert who was the truth teller, not unlike Dr. Lee in Wuhan, who spoke out on Tuesday, apparently drawing the president's attention in saying we will see community spread in the United States. It's not a question of if this will happen, it is a question of when and how many people in this country will have severe illnesses. Do you agree with her statement?
First, I know Dr. Messonnier extremely well over decades. I have the highest respect for her, and yes, we believe there will be. It's very because we have to be careful with the public.
As you know,
community
time is limited.
spread.
Do you agree with her or not?
There is context needed. Community spread could be in a town, a locality, or could be nationwide like China.
It could have begun yesterday or day before in Northern California.
In fact, this
Let me ask you as
15th
well,
case could be a community case. We
as
don't
you
know.
In saying disruptions to everyday life may be severe, but people might want to start thinking about this now. Do you agree with her on that?
That was a statement of a range of possibilities, which is, yes, we're dealing with a pandemic. There are elements.
Really,
that
the
could
question
be
is
severe.
whether or not the administration is moving based on this serious concern or just on putting a happy face on all this that'll go away when the spring flowers come out.
That's a
And I
complete
want to pursue
misrepresentation.
with you what some of the specific things the administration is and is not doing in that regard, beginning with the question of face masks. I'm sure you saw the story that the N95 mask that is important to those who are healthcare providers, that many hospitals only had a week's supply. What is the administration doing to assure that there's an adequate supply of those masks?
We're asking you to fund us buying masks.
I see. So we don't have them now, and 60% of large chain pharmacies also say that they've run out of masks for the public in general. On the question of lab tests, as you know, last Friday, the Association of Public Health Laboratories said that only 3 states had the capacity to test people for the virus. And in the case of what might be the first community spread in California, it's taken 4 days to determine whether that person had coronavirus. I've had this experience in San Antonio, where for anyone to determine whether those people that came off the ocean liner in Japan who are now at Lackland Air Force Base, we have to send the test off to Atlanta to get an answer on that. A problem about not testing people on the base, transporting them across town. Congressman Castro and I wrote you about this back on February the 13th. Despite numerous calls, requests, it's been difficult to get any answer about the specifics on that, though my staff advises that finally in the midst of this hearing, some message came through from you about that. Our localities, even considering trying to put people in recreational vehicles to keep them separate if they have the coronavirus in full. The city of San Antonio has not received any reimbursement for these matters to date. It's unclear to me whether the administration has in place a plan to send extra reimbursement to localities faced with a problem. The ineptness with which the administration has approached this problem is not only serious, it can be deadly if not changed in the approach.